All right, welcome. Welcome to UT Southwestern Science Cafe. We are so glad to see both our regulars and our new guests online this evening. My name is Jenny King, and I'm part of the public affairs team at UT Southwestern. On behalf of my colleagues, Joya Lang and Charlandra Thompson, as well as our guest speakers, Dr. Ahmad Raza and Dr. Jennifer Hughes, thank you for joining us. Science Cafes are online conversations where our faculty and guest speakers take you on deep dives into science topics. We also have fun while we learn. Our format is casual and interactive, and we encourage you to ask questions and engage with us during the program. This evening, we'll be discussing winter blues, prioritizing mental health as we approach a new year, with both Dr. Hughes and Dr. Raza, and more on them in just a moment. So before we begin, we have a few things to mention regarding technical matters. First, we are recording this program and live streaming it on our UT Southwestern Twitter page. Please mute your microphones during the presentation to help with everyone's audio clarity, and just unmute yourself if you are called on to ask a question. We do encourage you to utilize the chat feature to list questions for Dr. Hughes and Dr. Raza. We will start Q&A at the conclusion of their presentations. Joya will be facilitating Q&A, and we are monitoring your questions in the chat box. Plus, we want to say thank you to all the questions that you submitted in advance. And finally, just a reminder, while we cannot answer personal medical questions, we would love to hear from you with your general questions on tonight's topic. And with that, I'm very pleased to introduce our speakers. Dr. Ahmad Raza is a professor in the Department of Psychiatry at UT Southwestern Medical Center. Certified by the American Board of Psychiatry and Neurology, Dr. Raza joined the faculty here in 2005. He has been involved in teaching and training medical students, residents, and psychiatrists for 25 years. Dr. Jennifer Hughes is an adjunct associate professor in the Department of Psychiatry here at UT Southwestern, and she recently relocated to Ohio, where she is an associate professor in the Department of Psychiatry and Behavioral Health at The Ohio State University. Dr. Hughes and Dr. Raza, thank you both for joining us this evening, and welcome to Science Cafe. Dr. Raza, the virtual program is yours. Podium is yours.
Good evening, ladies and gentlemen. Can everybody hear me clearly? I appreciate you taking the time out from your busy holiday schedule to focus on a very important issue. As I was preparing for this evening's lecture, I couldn't help thinking about March 2020. Around the 15th of March, I got an invitation from NPR to speak on their program Think about the COVID pandemic, which was just beginning at the time. And I remember receiving the invitation right around the middle of March. And by the time we were getting ready to do the program, which was about 5 days later, the world had changed. So rather than going to their studio to do the program, everything went into lockdown within those 5 days. I had to scramble, get the headphones, which was still available at that time, and really do it remotely from my office. And couldn't help thinking how literally in a matter of days, our lives had been transformed. And it's interesting that before this discussion, before this lecture, I got the invitation. This was about a few weeks ago, and I was thinking to myself that what we're going to talk about is that, the pandemic is behind us, normalizing, and hopefully this will be a different holiday season. Well, it turns out a few days ago, we got the news about another variant of interest, at least, if not seriousness. And again, we have to reset and sort of think about our priorities. So just to, holiday season is a somewhat of a stressful time. There are a lot of joyful aspects to it. But with this backdrop of disruption in our lives, the uncertainty, and frankly, the not knowing where, if and when this thing will end, and if and when life will normalize, and what life would look like if it does. I think in the backdrop of all of this, the stress of holidays takes on a very different context. Glad that we are doing this, and hopefully we'll have some useful tips that will come out of this. Let me start sharing some of my slides with you. I have a brief presentation, basically trying to really sift through some of the data, scientific data that we have on holiday blues. And then I'll invite Dr. Hughes to talk to you a little bit about strategies as to how to deal with those. I think that this old saying from the Old Testament by Ecclesiastes is really defines both the spirit and to some degree, I think, the problem that we could have with holidays. So eat, drink, and be merry. Ecclesiastes was actually a little bit of a nihilistic person. So his viewpoint was, this is the sort of the book of wisdom, so to speak, which is part of the Old Testament. It was to that despite all the tribulations of life, unfairness of life, there are certain things we can do to share in the joys of life. So in the Christmas season, while this is the spirit of Christmas, this can also be our undoing. Sometimes we tend to overeat. We tend to overdrink. Sometimes we tend to expect that we're going to be merry all the time. So while I think you should pay attention to this, you shouldn't take it too hard and exercise some degree of caution. I think when it comes to dealing with any situation, whether it's stressful, joyful, our individual temperament, our personality traits, our issues, our coping mechanism, or for that matter, our resilience, all come into play. And we see it very frequently in our clinical life. Depression can affect a lot of people, but depression manifests itself in terms of behaviorally or how it impacts people differently. It depends on what your personality profile is. To give you an example, as somebody who's dependent, when they get depressed, they're going to become more dependent. Somebody who's more avoidant, when they get depressed, are going to become more avoidant. Somebody who has more obsessive compulsive tendencies are going to tend to exert more control over the situation. So the point being that each of us has our own way of dealing with certain issues, particularly stressful times. It's important to have a little bit of self-awareness in terms of what those issues are, so that you can, at least in your case, deal with it. So there are many, many studies that have been done that have looked at different types of stressors, different types of factors that contribute to holiday stress. There are multiple surveys. It just depends on how you ask the question. But I think if you generally ask people the usual things that you can probably intuitively guess, lack of time and too many responsibilities, financial stress, the social pressure and obligation, the family issues and conflicts, sort of not being able to restrict yourself to a healthy lifestyle during this time. All of those are known factors. Different surveys will show different importance of those factors, but I think it's pretty much agreed upon that those are the main reasons why we tend to feel. And if you look at the source of stress, you'll be surprised that we, intuitively would think that it's our home and family life. It turns out that at least in some of the surveys, and this is actually a study that was done by American Psychological Association, it's basically a survey of roughly 700 plus people. And what they found was that actually it's work-related stress that tends to be at least as more significant by almost a margin of 2 to 1. And the work-related stress was typically because of multiple issues. One was whether you're going to be able to get time off, whether the work is going to intrude into your personal life. And for some professions, including our healthcare profession, as you know, that the holidays can actually be a busier time, particularly, the rate of infections tends to go up, the flu and influenza, the inpatient hospitalizations. So seems like that work-related stress actually may compound the problem, whereas intuitively one would guess that it's home-related. So the results were, the question is, which demographic groups are most susceptible to holiday-induced stress? Younger age group, women, lower middle income, none of the above, all of the above. And 56% of you guessed the right answer, which is all of the above. And so we have a very smart audience. So if you were to look at the susceptibility, you can see that women in general are much more likely to feel the holiday stress as compared to men. And that is understandable in some ways. They are the ones who will generally take on more responsibility, both for the family, for gift buying, and generally will take on more stress than men. And as you can see, at least 12% of the men should report decreased stress because they just simply pass it on to women. The stress of, you can see women almost increases by the same proportion as the stress of men decreases. So this is no surprise at all. So women are generally more likely to feel the holiday stress, as are people in the lower middle income. So you can see that people who are in the lower income group, they have perhaps lower expectations and therefore, will not go out of their way. People in the higher income group, as you can see, in the 50K plus group, they hopefully, even if there are expectations, they can afford it. It is people who are in the 30 to 50,000 income range who have expectations, but perhaps not as many resources, who end up bearing the brunt of the stress. Joya, we can launch the next poll question.
Absolutely. The incidence of psychiatric emergency room visits peak at Christmas time? Okay, I'm gonna close it out.
So the results are 81% said true, 19% said false. So let's see what the data shows. There's really only one study that was done in 1981, published in the Archives of General Psychiatry. Which actually showed the opposite of what you intuitively would think. That the emergency room visits, now emergency room visits is a proxy. It is by no means an accurate reflection of how people are doing, right? Because there are many, many practical matters for seeking treatment right around Christmas time. But you can see that starting in November through Thanksgiving, you generally have a decline in emergency room. And then once you hit Christmas, soon after that, there's an increase in emergency room visits. But the increase basically is compensating for the previous decrease. So people just put it off, or the resources weren't available. So basically, it actually declines and then goes up a little bit right after this. Next poll question, John.
Yes. Suicide rates are the highest in fall, winter, summer, or none of the above? Lots of votes on this one. All right, I'm going to close this one out.
Okay, so the results are 8% of you suggested that they are highest in fall. 77% suggested they're highest in winter, and 4% suggested in summer, and 11, none of the above. So more than 2/3, 77% thought it's in winter. And the data shows that exactly the opposite, that actual suicide rates are the lowest in December. Right around Christmas time, you can see the graph, it starts from July. They gradually keep going down until they hit the lowest point in December. And then they somewhat rapidly go up in the January time. But the highest rate of suicide is reported really in spring or summer months. And there are a number of different theories as to why that. This is a fairly consistent one. So actually, counterintuitively, those rates, at least right around Christmas, tend to go down. Why do they come up in January? You know, there are any number of theories, and we can discuss those later in the interview. So that is, you know, sort of some of the data before the pandemic. Since the pandemic, if you look at this National Health Interview, NIHIS, which was part of the census, basically. Between January and June of 2019, which is in the pre-pandemic time, about 11% of the adult population, general population, reported, anxiety or depression. This is based on one of the scales, CAT2 or PHQ. A poll later conducted by Kaiser Family Foundation in January 2021, and this is a tracking poll, so this is an ongoing poll, found that 41%, so the incidence of anxiety and depression had gone up by 4-fold over this period of time. And we've seen a lot of different data, and it is to be expected that during the pandemic, we've had as many as 70 to 80% of the people in some of the surveys reporting sleep difficulties, anxiety, irritability, depression, increased rate of alcohol use. So the demographic groups which are most susceptible to these issues since COVID-19, as you would expect, are the minority. They are the ones who have been hardest hit by it. They are the ones who have the least resources, both medical and mental health resources. So you can see 42% of all adults reported symptoms of anxiety and depression, but the Hispanic or Latino population and non-Hispanic Blacks represented a much bigger share. And for some reason, the non-Hispanic Asians, even though they've been stigmatized more, and sort of there's been a little bit more scapegoating, tended to have actually lower rates. That may speak to the social networks, their expectations, their resilience. And if you look at by different age groups, I think there was a poll question here that you skipped, but I think we'll skip that one and we'll go to the next one. So as you can see, the age group that was most affected during this time was the younger age group. And that is to be expected, right? The schools closed down, the colleges closed down, the economic pressure on them was different as compared to adults. And generally the social isolation would affect that age group to a greater degree. And in fact, in some of the other data, some of the older age groups have also not fared too well. And if you look at the essential workers, there's enough data from the previous pandemics that healthcare workers are much more prone to pandemic-induced stress for any number of reasons. They're more exposed to it, they're more at risk, see some things which are very distressing. So it is no wonder that if you look at the essential workers, and that includes healthcare workers and all the essential workers, the incidence of anxiety, substance use, or seriously considering suicide was much higher than it was in the general. So next up, the poll question about the sentiment.
Absolutely. Which of the following is cited as the most common sentiment during the holidays during the pandemic? Guilt over alcohol use, stress from in-laws, lack of energy due to sleep deprivation, or loneliness? Okay, I'm gonna close this one out.
And the responses are 89% of you said loneliness. You're absolutely right. In fact, in most surveys, depending again how you pose the question, what the intent of the question is, most surveys will show that loneliness has been quite a significant factor. And if you look at the post-pandemic, some of the surveys, you can see that top of the list is isolation, which is essentially loneliness due to the pandemic. There are some people who always feel lonely all year long, but you can see a twofold increase since the pandemic. Find the two numbers, that is an overwhelming sort of number. If you look at this survey, this was done in November 2020. This was simply about 8-9 months into the pandemic. 25% of the people reported loss of a loved one at that stage. If you look at the total number of people that we've lost to the pandemic, I was reading actually 2 days ago, and the number was striking. I remember the number because it was so striking. It was 777,000 people. If you look at the number of people who were affected by a single person loss, on average, about 9 people are related to that person directly, either as a sibling, as a child, as a parent, as a grandparent. So you can see the toll that this pandemic has taken, both in terms of social isolation and the losses, other than the disruption. The next poll question.
Yes. Seasonal affective disorder is observed in spring and summer, winter and fall, none of the above, both of the above.
And the results are about 64% of you said winter and fall, and about 33% said both of the above. So the correct answer is both of the above. And although the winter and fall blues are way more common, again, depends a little bit on the latitude that you're in. So I think you can see seasonal affective disorder both in winter and summer. Generally speaking, in spring and summer, you tend to see more of the hypomanic or manic episodes. And in fall and winter, you're going to generally see more of the depressive type. And there's a huge association with latitude. The further you go away from the equator, and we can get into, in the interest of time, I'm going to have to wrap this up. But I'd be glad to go into more details during the question and answer session. as to what the fundamental mechanisms are, what the treatments are. But as a general rule, the further you go away from equator, the more temperate the climate, the greater the likelihood of at least winter seasonal affective disorder. The summer seasonal affective disorder is a little bit less well studied, but it tends to be more common closer to the equator. And if you look at the differences between major depression and seasonal affective disorder basically is a subtype of depression, not a separate entity. And one big difference there is that people generally tend to sleep more, eat more, gain weight, and have carbohydrate cravings, which are known as atypical features of depression. A lot more fatigue. And women are affected 4 times as frequently. And if I go back to the previous slide, you can see that while you see SAD in about 7% of the people in the northern part of the country, you see 20% of people who have winter blues, which is a sort of more subtle form. And since women are affected 4 times as frequently as men, you can see that not only the responsibilities on women go up because they have to share more of the burden, they're also more affected by seasonal blues or SAD. And then their stress tolerance, their ability to function, all of those can be compromised, which further compounds. So what I'm going to do is I'm going to stop here and gone a little bit over my time. I apologize for that. And I'll invite Dr. Hughes to kindly talk a little bit about what are the different strategies.
All right. Thank you, Dr. Raza. Can you guys hear me okay and see my slides? Thank you for the nod, Joya. So thank you guys for the opportunity to speak more about this tonight, and we appreciate you joining us. Dr. Raza did a fantastic job of really kind of laying out what we typically see when it comes to depression and sort of the winter blues. And so I wanted to unpack that just a little bit more and then talk about some strategies you can use to manage them and/or strategies you can use to support others who might be experiencing that. So I think by now you definitely understand that the winter blues or the holiday blues are something that exist. They are something that we see. It could relate to that sort of pressure to feel joy and the magic of the season. Obviously, for some people, the holidays remind them of the loss of family, friends, loved ones. Dr. Raza mentioned the impact of COVID-19 and the profound number of deaths that we've experienced here in the United States. And that very interesting idea that for every death, 9 people were profoundly impacted and are grieving this holiday season. And so I'm going to spend a little time talking about that at the end as well. And then for some, these holidays are just particularly difficult and sort of prone to bring on the blues because they just look a little different, right? Holidays in the pandemic have not looked the same or felt the same as some of our typical practices, the ability to get together with large groups or to attend some of the seasonal shows and opportunities. Last year, there was very little of that. I think this year, some of that's being brought back, but it still looks a little different. And so we know this is something that people experienced prior to COVID. And then to Dr. Raza's point, we're definitely seeing some upticks in these kinds of sad, melancholic moods during the pandemic. So we talked about some of the reasons for this holiday stress. You guys now know that, unfortunately, women are a bit more at risk for this. And, women are also twice as likely as men to have actual depression. And so, I think this is kind of a double whammy idea here that women are perhaps impacted more by the blues as well. I wanted to orient you all to this really useful website. It is by the American Psychological Association, or APA. And they have a website that is all about holiday stress. It's the Holiday Stress Resource Center. I've put the link at the bottom of the slide right here. And if you go there, you can find really specific articles written by psychologists about how to handle some of the different kinds of stress that come up in the holidays, financial stress, the stress of kind of wanting to be perfect or make a perfect holiday and having these high expectations, and some of the stress of family conflict that can come up this time of year. I know a lot of the questions we had submitted had a little tinge about what do you do with family conflict, and this website has some great resources and articles by different psychologists throughout the nation. So Dr. Raza shared with you guys that wonderful slide that really kind of pulled out the blues versus depression or seasonal affect disorder versus what we might see with depression in a different time of year, like the summer. But I just want to be sure we're all very clear. The holiday blues is actually really different from a clinical depression or a major depressive disorder. So clinical depression includes a cluster of symptoms that all occur together in time and space. Definitely a marked change in mood. So usually people will report sadness, but sometimes people will report being more irritable. And then also a lot of times people will report that they just aren't really interested in the things they used to enjoy. So maybe they don't want to spend time with friends as much. Maybe they don't want to do activities. And it's not laziness. It's that those things aren't really bringing the same amount of joy or pleasure that they brought before. And then there's other symptoms involved in clinical depression. A lot of them are physical symptoms. So things like appetite changes, and that can be being more or less hungry. We will see sleep changes. Sometimes that's sleeping a lot more. Sometimes that's sleeping a lot less and really having insomnia at the beginning of the night, in the middle of the night, or even really early in the morning. People with clinical depression will report concentration difficulties often, low motivation, feelings of guilt and worthlessness, fatigue or low energy, and sometimes even suicidal thoughts. And so when these symptoms all happen together and they last for about 2 weeks or more, and people are experiencing some of these things most of the day for nearly every day, that may be a sign that you have depression. And so if even at the holidays you start to feel this way and it really tips over into being more than kind of just the blues, I really encourage you to talk to your primary care physician or a mental health professional, because you don't have to suffer. There's things that could be helpful. And we don't want to just kind of ignore away these feelings and say, oh, it's probably just the holidays. Because again, if it lasts for 2 weeks or more, and it's not just sadness, but some of these other symptoms, it may be helpful to be screened for depression and see what your options would be for care. So one way to kind of check in on how you're doing is doing a strategy called self-monitoring. It's as simple as it sounds, right? Just checking in with yourself, checking on your mood, and having a structured way that you do that is really important. We actually know from the treatment literature that simply naming an emotion, so putting a label on the way that you're feeling, actually can help sort of like reduce the emotion or kind of bring the intensity of it down a little bit. And so really having a way that you stop and check in with how you're doing, some kind of scale for that, and then stopping and putting a name on your emotion can be really helpful, and will help you to do what I just mentioned, which is kind of track the difference between holiday blues or stress versus something like major depressive disorder or seasonal affective disorder, as Dr. Raza had spoken about. So I wanted to share with you guys tonight about a tool that was actually developed at UT Southwestern to support people with self-monitoring. The tool is called Vexia, and it was developed by our research lab at the Center for Depression Research and Clinical Care with Dr. Maduka Trivedi. So one moment, please.
Health and well-being are a journey, not a destination. So why should mental health be any different? Everyone from athletes to students to healthcare providers are recognizing the importance of mental health in our lives. Self-monitoring is a powerful way that individuals can take action to improve their mental health and overall wellness. Active self-monitoring will help you become aware of your mental health so that you know what your normal looks like and can immediately take action if you notice any changes. So, where do you begin? Introducing Vexia, a self-monitoring tool that puts you in charge of your mental health and well-being. Developed by professionals in mental health care, Vexia provides access to research-driven measures combined with tailored feedback that provides real-time data about your well-being over time. Best of all, it's free and confidential, so only you have access to your data and can download and share with your healthcare team whenever you need to. We developed Vexia to empower everyone to take charge of their mental well-being, because wellness matters. Join the movement to take control of your mental health and sign up today.
Okay, I'm hoping you guys were able to hear that okay. And now You can see me again and see the screen. So, for depressive symptoms, but also for anxiety. You'll find some measures about resilience, and you'll also get some tailored feedback if you continue to use the program over time, where you can really kind of track what your symptoms look like. And if it gets to that point where it's sticking around for longer and you're concerned that you might be crossing into more of a clinical depression, you can even print the results and take them to your doctor. And so we're hoping that that's a useful tool that many of you would be willing to try. Turning a bit more to some strategies you can layer on top of that self-monitoring. So step one is noticing that you're feeling the blues or you're feeling stress that and to help yourself during those times. So first of all, we just know that basic self-care is so important when it comes to mood management. What I mean by that are things like sleeping, more of the helpful. I think we're surrounded by the sugary sweet things in the holidays. And of course, we want to eat those. They're wonderful. And at the same time, making sure you get some greens in there can be really important when it comes to mood management. And then also just taking time for yourself, making sure that you give yourself some space and time. Maybe take a long walk, listening to your favorite music. If it's good for you, going to get a massage. Really in the midst of all the holiday busyness, making sure that you've got emails or doing that activity while also mentally making your grocery list, right? But instead trying to use your mind to focus 100% on that self-care activity so that you'll really get the most benefit from it. We know another way that you can manage the holiday blues are by volunteering. So taking some time to give to others. That helps others, but it also has that rebound effect of helping you as well. Again, taking a look at your expectations, trying to keep them as realistic as possible. I think practicing a little acceptance around the fact that the holidays this year are probably going, so again, it's adjusting the expectations, recognizing that no holiday is going to be perfect. All we can do is a couple of things. One, reflecting on your values, reflecting on what's really important to you about the holidays and what the celebrations mean for you. And then also taking some time to have gratitude, to really stop and reflect on the things that you're grateful for. That's not just a Thanksgiving practice. That is something that is really important throughout the holidays. And in fact, there is some research in the field of positive psychology season, but it definitely is something that would be important to do during this time of year. And then lastly, seeking support, making some time to spend with your friends, knowing who your go-to person is when you start to feel a bit of stress. Who can you go to and talk about that? Who can you feel comfortable sharing some of those stresses of the season with? Identify who that person is and make some plans to see them periodically, like a coffee break, for example. I thought this was a great graphic from Mental Health First, a little bit of a holiday tinge to making sure you get enough sleep. So again, part of that self-care idea. Break out the skates. So taking time to exercise and move your body around. Again, don't freeze people out. So making sure that you do spend some time with people that love and support you during the holidays. And then moderation when it comes to merriment. So eating and drinking in moderation. And if you are feeling down, really avoiding alcohol because that is a depressant. And we know that it's more likely to make you feel even more down when used. I wanted to give a special couple of comments about parents and how they can manage holiday stress with their kids. You're going to notice some of these strategies look very similar to the coping strategies that we recommend for adults, but you're going to be modeling these things so that your kids will see them and hopefully will learn from that as well. So again, taking time to talk to your so important. Thinking about volunteering with your whole family, that could be a really great activity for the family to do together that also allows time to kind of shift the focus away from a season of getting things and a season of presents to a season of also giving to others. It really can be an important time for parents to share religious or cultural practices, but also to educate your family about some of the other sort of cultural celebrations that people in your community have so that your children can learn more about that and that paying attention to the thinking. So really setting expectations, keeping things in perspective, noticing when that thought starts to spin out of control about everything has to be perfect or has to be a certain way. that you did, that don't rewrap that present that you let your child wrap for you, but give them the opportunity to learn from that. And then identify those holiday tasks that are really important to you and take small steps towards getting those done. There's more ideas at the website listed below. And then lastly, I just wanted to take a moment to talk about grief and the holidays. We mentioned that, quite a few people could be experiencing grief this holiday season. And we know that the holidays are a time when people really sometimes notice that that person's really gone. We have a big favor to ask. I don't know if we can remove the image, Dr. Hughes, because we are having a bandwidth issue on your transmission.
Okay, we are going to jump right in to some questions that were submitted ahead of time. If you have any questions for the doctors, please write them in the chat. But the first question is, are lights that people use for this effective? So I've heard of happy lamps. I actually have one myself. What is the science behind this? What is the evidence behind it?
So I believe you're asking whether bright light therapy is effective in seasonal affective disorder.
Yes.
And the answer to that question is yes, it is. There are several studies that have been done that have shown its effectiveness, to be definitely in excess of 50%. And in fact, some of the evidence suggests that even in people who have a non-seasonal depression, that they're beginning to recognize people who don't have a clear seasonal component. But the light has to be a specific type. So it has to be bright light. It has to be full spectrum. Typically, we recommend that you have, intensity of light is measured in lux, L-U-X. So you typically want to get at least a 10,000 lux, something that filters out the ultraviolet radiation. And these are fairly cheap if you go on Amazon.com, although Rosenthal, who was the person who first identified SAD, believes that it shouldn't be too small. Some of those small contraptions don't work. So the typical paradigm is that you use that bright light, typically first thing in the morning. It can produce some eye strain, so you gradually want to ramp it up, starting with 15 to 20 minute exposure. You don't want to look into the light. You generally want to have it at about a 30-degree angle. And the best thing eventually is to use it first thing in the morning, as early in the morning as you can, after you wake up, and for about 30 minutes and on a daily basis. But aside from that, you should also try to expose yourself to natural light. Midday, walking out in the sun, keeping shades open, all of those strategies. The lights itself, the medications can also be effective. There's some controversy about whether the combination is more effective than either one of those alone. But light therapy, bright light therapy is a very, very easy fix. And it's definitely worth a try. In somebody who has seasonal affective disorder, it's definitely, it's obvious, but a lot of people, about 20% of the people, depending on where you're living, they'll have subsyndromal depression, that they have the blues, similar to the holiday blues versus the depression. So I think those are the people that it can easily be missed. So it's a fairly benign treatment. I would recommend really to have a very, very low threshold.
Thank you, Dr. Raza. Next question that was submitted ahead of time. How do we handle yet more bad news about COVID, particularly the new Omicron variant, without sinking into a renewed anxiety about the pandemic?
That is I don't think Dr. Hughes is here, so I'm going to. You're absolutely right. I mean, the thing that is most difficult for us today is generally a sense of uncertainty. We take risks all the time in our life, but those risks are sort of known entities. We can contextualize or put those risks into a context. When things are uncertain, no matter what theory of biology or psychology you look at, our anxiety or fear mechanisms are particularly triggered by uncertainty and unknown events. Not only that, even if you look at Dr. Hughes talked about grief and all. David Kessler, who is one of the leading authorities, believes that part of what we are going through with COVID is really a grief and loss. It's loss of a number of things, autonomy, but most importantly, loss of safety. This is an invisible agent. You won't know where it is. You have no idea who's carrying it. And so that whole thing sort of gives it a very different level of mystery or fear, so to speak. So I agree with you that the uncertainty itself is a very difficult thing to deal with. We don't know when this is going to end. We don't know what our life is going to look like. Because some things have changed, from a perspective of how we work, how we travel, how we enjoy things, and so forth. I think the only comfort that we can take in that is that they're at least about the disease process itself. Remember way back in March of last year, we had no idea what to do with this virus. Now we have some effective treatments. We know that we can develop the vaccine, viral drugs quickly. We know what steps need to be taken in order to limit the damage and the spread of what may be a variant of interest. At this time, it's just a variant of interest. We don't know, really. We don't have enough data to support as to what the actual impact would be. But you're absolutely right that this is uncertain times. And I think what we should do is focus on what we can do as opposed to the uncertainty. We know what measures we need to take in order to protect ourselves and, more importantly, even others from this. So I think it throws a whole different wrench into this current equation that we're dealing with. But at least we have a little bit better knowledge and understanding. So the critical thing is not to get alarmed, not to get overly stressed out about it, but think about, wait for the facts, consume the facts like a smart, educated person, and be willing to take the steps that you need to take.
The only thing I would add, and sorry everybody that I dropped off, but making sure you set a really kind of discrete and set amount of time to let yourself reflect on COVID or to look at news about COVID-19. We really have found that people sort of cope better if they set aside almost like a pocket of worry time every day. And when you stay up to date on information and look for facts, as Dr. Raza mentioned, really checking like your local authorities and local news too, because it can be very tempting to follow sort of the international perspective of how things are. And that is important to do maybe once a week. But really, when it comes down to it, how COVID-19 is impacting you right now is more in your community. So looking to your local public health resources can be helpful as well. And I put a link in the chat to Dr. Kessler's work on grief and COVID-19 uncertainty that Dr. Raza referenced. So hopefully you can find more information there.
Thank you both. Dr. Hughes, now that you're back with us, there's a question from Subaru, and I'm not sure if they want to unmute and ask it. I'm going to give them a few moments to unmute. If not, I will ask it myself. Subaru. Okay, I'm going to ask it for them, and it's to you, Dr. Hughes. Is a Vexia an automated tool like a bot, or is there a human that reviews behind the scenes?
So all of the privacy policies are written when you sign up, so you can read the sort of fine print there. But I will say that the measures themselves are scored by an algorithm within the website. And these are pretty commonly used screening measures. For example, the PHQ-9, the Patient Health Questionnaire 9, which is used by many doctors to screen for depression. You could find it if you Google it, to be honest. And so you could even take the measure and sort of score it yourself at the back end. Definitely, there is a data warehouse, and this data is held. Again, I encourage you to read the fine print if you sign up, but it would not be a person that is per se sitting down and like looking at your specific data. It's more held by aggregate, and the scoring and recommendations that happen through an algorithm.
Thank you. Next question. Let's see. Please discuss CBD. No medications prescribed have helped me. For either of you.
Yeah, so, this is a slightly difficult question to answer. Obviously, there's a lot of news that we hear about efficacy of these, a lot of treatments in just a whole host of different conditions. There is better evidence for some than others. I'm sure that you've been hearing a lot of chatter about psychedelics and how they could be treatment of different disorders, including depression, as well as PTSD. I really don't recommend to people in general using CBD oil simply because it's not my area of expertise. I really don't know if there's just, sort of hardcore, sort of good studies and scientific data to suggest efficacy of these. So I think I would really have to pass this question in the sense that I really have no opinion about it. Generally considered to be relatively harmless. At least that is what we all think. So if somebody asks me this question, I tell them that, listen, I can't recommend it, but I'm not going to stop you.
Dr. Hughes, do you want to chime in or leave it at that? No. Okay, great. I'm going to ask one.
Leave it at that. He's the medical doctor. So we'll go from there.
Excellent. I'm going to ask one final question and kind of wrap it all together. Someone says, hello, I'm a high school teacher. Our students have had serious mental health struggles. How can we best help and address this with them? And I think just as we close out, if you could give maybe advice to people who might know someone who's struggling, just any advice?
Yeah,
that is more of Dr. Hughes' area of expertise, so I'll let her go.
Let me just say, number one, that we do have a school-based mental health.
Oh, you're muted again.
Somebody is muting me. It keeps telling me somebody's muting me. I don't know what's happening, but we do have a school-based mental health promotion program that is disseminated through UT Southwestern called the Youth Aware of Mental Health Program. If you're a teacher and you would like information about bringing that to your school, feel free to reach out to me and I can connect you through with our program coordinator for that. I'm still involved with that program from afar. As far as it goes supporting your friends who may be experiencing holiday blues or stress during the holidays, or your family members, number one, I would say have grace and patience for them and recognize that just because they're feeling down or sad or blue, it doesn't mean that you have to judge them for that or that you have to expect them to meet your expectations for the holiday. Number two, I would say give them some time and space if they request that, but check in with them still. They may decide that they do need some time on their own during the holiday season, and that's okay. And at the same time, we all know the importance of how it can feel good to have somebody check in when you're feeling lonely. And then also, if it's your partner or someone that you're going to a party with, I recommend having kind of like a code word or a password so that when the person who's been feeling down has maybe hit their limit or just had enough of that family or friend gathering, that they have an easy way to make an exit with you and that you can support them in setting that limit or boundary for themselves. And then lastly, I would just say, you taking care of yourself is going to keep your stress down so that you're then better able to support the people that you care about. And so again, practicing some of those self-care tips that we went over earlier that I'm hoping you heard before I got kicked off. And again, just being willing to kind of be there for them, listen and meet them where they're at with what they are able to do over the holidays, even if feeling down or stressed.
Thank you, Dr. Hughes and Dr. Raza, and thank you to everyone for your patience with our Zoom connection tonight. When we go live, these things can happen. This discussion was a timely and informative message as we enter the holiday seasons, don't you think? Thank you, Joya and Jenny, for helping run tonight's event. While this is our last episode for 2021, we will be sending out a survey on Monday to gather your feedback and suggestions as we prepare for the new year ahead of Science Cafe. We hope you'll take the time to complete the survey as we value your insight. Before we adjourn tonight, we must implore you and your friends and family to protect yourself against COVID-19. For more information, click on the yellow COVID info bar at utswmed.org. Finally, even if you are fully vaccinated, please continue to wear your mask, social distance, and be vigilant with hand hygiene. Thank you for doing your part to contribute to our collective public health. As we close out, we wish you all a happy holiday season and a happy new year. Thanks for joining us tonight and for helping us with a fantastic year of UT Southwestern's Science Cafe. We are adjourned.
Thank you, ladies and gentlemen.
Thank you, Dr. Raza and Dr. Hughes and our guests this evening.